Diabetes, presented by Brandon and Daniel. Hello, everyone. My name is Brandon, and for this project, I worked with my partner Daniel on the topic of diabetes. We divided the presentation by types of diabetes so that each of us could focus on a specific area. Daniel covered type 2 diabetes, while I focused on type 1 diabetes. In my section, I'm going to explain what type 1 diabetes is, the main warning signs, how it's treated, and the key points people should understand about living with it. What I will cover. For my section, I will start by explaining what type 1 diabetes actually is and how insulin is involved. Then I'll go over the most common symptoms and warning signs, along with how the disease is diagnosed. After that, I'll talk about treatment and daily management, and I'll finish with the main takeaway points. Why start here? Type 1 diabetes happens when the immune system destroys the pancreatic cells that make insulin. That means glucose stays in the blood instead of moving into cells for energy. What type 1 diabetes is? Type 1 diabetes is a chronic autoimmune disease. That means the body's immune system mistakenly attacks the beta cells in the pancreas, which are the cells that make insulin. Insulin is important because it allows glucose or sugar to move from the blood into the cells where it can be used for energy. Without enough insulin, glucose stays in the bloodstream and blood sugar levels rise. Type 1 diabetes makes up about 5 to 10% of diabetes cases, and although it is often diagnosed in children and young adults, it can develop at any age. A quick mechanism view is autoimmune damage, little to no insulin, and then high blood glucose. And then we also have a small diagram that depicts what diabetes is, type 1, and it also does list type 2 diabetes, but we will also go over that shortly. Warning signs and diagnosis. One important thing about type 1 diabetes is that the symptoms can appear quickly. Some of the most common warning signs are increased thirst, frequent urination, hunger, fatigue, blurred vision, and unexplained weight loss. Other signs can include frequent infections, cuts, or bruises that heal slowly, and tingling or numbness in the hands or feet. In some more serious cases, a person may develop diabetic ketoacidosis, or DKA, which can be life-threatening. Because these symptoms can progress fast, early testing and diagnosis are very important. Treatment, technology, and daily management. There is currently no cure for type 1 diabetes, so treatment is lifelong. The most important part of treatment is insulin therapy because people with type 1 diabetes cannot make enough insulin on their own. Daily management also includes checking blood glucose levels, eating a balanced diet, staying physically active, and having regular medical follow-ups. Many people use tools like insulin pumps and continuous glucose monitors, which can make managing blood sugar easier and more accurate. Type 1 diabetes has no cure, so successful care depends on daily decisions. To conclude, some of the key takeaways are that type 1 diabetes is a serious autoimmune disease that requires lifelong care. Its symptoms can appear quickly, and insulin is necessary for survival. Even though there is no cure, early diagnosis, consistent treatment, and modern technology allow many people with type 1 diabetes to live full, active, and healthy lives. The most important takeaway is that awareness and proper management can make a major difference in quality of life. Bottom line, knowing the signs, support early diagnosis, respect the daily work of living with type 1 diabetes.
And today I'm going to be talking about type 2 diabetes. Type 2 diabetes happens when the body does not use insulin well or cannot make enough to keep blood sugars in a healthy range. And today I'm going to be talking about insulin resistance, the symptoms, complications, and the daily management it takes to live a healthy life while suffering from type 2 diabetes. I'm going to cover what type 2 diabetes is, the main causes and risk factors, common warning signs and diagnosis, complications that can be life-altering or even life-threatening, treatment, medications, and preventions. So why is talking about type 2 diabetes so important? 40 million Americans are living with type 2 diabetes, and some may not even know it. Early detection and proper management really reduces the effects it could have on your life. So what is type 2 diabetes and how is it caused? Well, cells in muscles, fats, and liver do not respond to insulin as they should. That causes blood sugars to rise, and glucose builds up in the bloodstream instead of moving into the body efficiently. Then the pancreas doesn't keep up. The pancreas may not produce enough insulin to keep the glucose levels in healthy range. Major risk factors include obesity, low physical activity, poor diet choices, family history and genes, and some racial and ethnic groups are affected more. Obesity is the leading cause of this and is so what is type 2 diabetes? Common symptoms of type 2 diabetes include more thirst, more urination, more hunger, unexplained weight loss, tiredness, blurred vision, slowly healing sores, frequent infections, and numbness or tingling in the hands or feet. Diagnosis is included in blood tests, and they confirm whether your glucose levels are above healthy range or in range, and if they're not in healthy range, you may have type 2 diabetes. What can happen if it's not managed properly? It could lead to heart disease, stroke, high blood pressure. You could have nerve damage, causing tingling, pain, or even loss of feeling. Kidney diseases that could lead to dialysis or even the need for a kidney transplant. Eye damage, including cataracts and glaucoma. Many of these could be life-altering or even life-threatening if this disease is not handled properly. Common symptoms of type 2 diabetes. The most common form of treatment is just changing how you live your life. You gotta eat healthier with fewer calories and more fiber. You gotta regularly exercise, simple as walking or swimming. If you're obese, you may need to lose some weight, as well as checking your blood sugar levels to make sure you're in that healthy range. Some people have to take medication. Two common forms of medication is metamorphin, that lowers glucose levels by decreasing the amount of glucose produced by the liver, and DPP-4 inhibitors that help improve A1C by preventing the breakdown of hormones that reduce blood glucose levels. The most common disease that requires lifelong insulin and monitoring, as Brandon talked about earlier. And type 2 diabetes is strongly linked to insulin resistance and common lifestyle related risk factors. Both conditions can lead to serious health complications when blood sugar is not controlled. Early diagnosis, treatments, and education improve quality of life and health outcomes. Whether the focus is on type 1 or type 2 diabetes, the strongest takeaway is the same. Recognize the symptoms early, manage the disease consistently, and that can prevent severe lifelong damage, leading you to be able to live a full, active, and happy life. Thank you.